How to Pick a Therapist with Dr. Edith Shiro and Gary Napier. I know you've seen both now on different sessions, and I'm so happy they're coming together for this and very insightful one. Here you'll gain insights on selecting the right therapist for your needs. The session will guide you through the process of finding a mental health professional who understands the unique pressures of yacht life and can provide effective support.
Hello again.
Hi.
Hi, how are you all?
Hi. Nice to see you.
Nice to see you too. So I just want to reintroduce the two people that we have here on screen. It's Dr. Edith Shiro, who's a clinical psychologist, co-founder of the Trauma and Resilience Center and author of the book, The Unexpected Gift of Trauma. And I also have here on screen Gary Napier, who is a psychologist, life coach, and founder of Gap Counseling. So we're talking about how to pick a therapist. And as someone who's been in therapy for, I think, over a year now, I went through that experience a year ago, and it wasn't easy. It's not the easiest thing to do. So hopefully in this talk, we're going to be able to guide you through how to pick the right therapist and what to look for and what that therapist is going to be able to work with you on and do for you. So let's start with talking about what it is about crew on board and the unique mental health challenges that they face in that situation. I'll start with Edith.
Yes. And actually, earlier on, I was talking a little bit about that when I was talking about trauma. And I really love the conversation you had about alcohol use and abuse. I think one of the big challenges as a clinical psychologist that I have and living in Miami, I've worked with crew members and I've worked with some of the yachting community. And what I've seen that is very unique to this culture is the level of isolation sometimes that people have to experience, not for a day, for a week, but maybe sometimes even for months. And that exacerbates and increases the isolation, increases the incapacity to find resources for help or to have more structure or more support system. The other thing is maybe not having a routine to be able to follow every day because of all the changes, because there's not like one place to sleep or to eat or to please, because people change. Another thing is like dealing with cultural diversity. Sometimes we come into working on a boat with people that are so different from us and from a cultural perspective, from a way of talking and speaking and eating and dressing and understanding life, and those belief systems might be very, very different from ours. So how do we develop that tolerance or dealing with those changes? And another thing that I think happens is also that sometimes we don't have the support system around when something happens on the boat, because everybody is coexisting together. There's no boundaries sometimes. So the work environment and the personal environment or family or friends are all meshed with each other. So you're wearing like different hats and different roles at the same time. Sometimes I am a crew member, sometimes I'm just a friend, sometimes I'm a supporter of somebody else, sometimes I'm like, but so it can be very challenging. So, and then that's very unique to the yachting community. So no wonder some of the traumas and some of the anxieties and depressions that happen, get manifested with drinking and with many other issues. So,
yeah, I think it's important to understand that the situation that crew find themselves in isn't normal. No sleep, living and working with your colleagues, sleeping next to your colleagues, and just being in such close proximity. It is a pressure cooker, and while you're all in the same boat.
Yeah.
Some people have the capacity to handle it maybe better than others. And if you're struggling, it's okay, because it's not a normal and particularly healthy circumstance. That's for sure. So when it comes to picking a therapist, if you've just made the decision that you want to try therapy, give it a go, think it might be helpful, I guess we're going to talk about what it is that you need to look for. Because when I was searching, therapist near me, it came up with a directory, and it was hundreds and hundreds of pages of headshots, names, and little acronyms at the end of their names that meant absolutely nothing to me. And it was overwhelming, and I didn't know where to start. And that was one of the reasons I had put it off for so long. So let's talk about the little acronyms. What are the qualifications that you're trying to look for when you're picking a therapist? Gary, would you like to go first? Oh, I think you're muted.
Yeah.
There we go.
Can you hear me? Yeah. So when I was in therapy years ago, I was referred by somebody, which is often the safer way, because they know you as a person and they'll trust the person they refer to, that there'll be a connection. As you said, for the majority of people, it is going through a directory list and thinking, right, how do I go through tens and hundreds of people and pick out a therapy that's for me? I've done that recently for one of our daughters, and I go by a feel connection. So even if I look at the qualification, what they're experiencing naturally, of say for anxiety, it'll bring up a list of people with anxiety. But the number one importance to me, and I say this to people when I'm assessing them and referring other counsellors to them, is, do I connect to this person? Another word for connection. Do I relate to this person? Because without the connection, without being able to relate to this person, it's unlikely you're going to fully open up. You're not going to feel fully safe. And therefore, the relationship itself is restricted before it starts, because the connection is, if you saw on the internet, if it says weak, it's going to feel like, well, this is not going to last. So you want a connection that's very, very strong. And that connection could be anything from as simple as, well, I like the look of that person. There's something about it that makes it feel warm. It could be their experience. It could be culturally, I can relate to them. It could be they're in the same location, I want face-to-face, but whatever makes you feel connected to that person. I would also say, in a more academic arena, and I'm sure Edith's aware of it, there are a lot of people out there who set them up as therapists, counsellors, psychologists without the required training or the qualifications. And that is very harmful. But as a person, you're not going to know that. So I would, as part of looking for a therapist, is check out their qualifications. Are they registered? How long have they been practiced? Because you need to be also certain that, as well as having that connection with the person, they have the ability to help me and support me. And I'm going to feel safe throughout the journey with this individual.
And what are the qualifications that we're looking for?
So in the UK, there's the highest, the most recommended profession is the BACP, and also you could go on the counselling directory. So to go on the counselling directory or Psychology Today, you need to be a recommended practice. You've got of credibility. There's also another platform, not sure if you have it in the US, it's called BARK, B-A-R-K. Now, that's another source of clients finding therapists, but I would say it's also open to people who've just set up as a therapy on their own, without the right training. So I would say just be a bit more careful. But generally, when you speak with that person, once again, it goes back, do I feel right? Do they understand me? Do they relate to what I'm speaking to them about? So if I don't feel that I can relate to their problem, or I'm not the best experienced person in terms of what they're looking to achieve, I would refer them to somebody else, because it's not, the demand outstrips the supply. So it's not an industry whereby you're fighting, therapists are fighting over clients, so we just got to sell ourselves. No, it's really about putting the client first. So as a client looking for a therapist, once again, do I connect? Do I feel safe? Will I feel heard? And can they help me make the change that I'm looking for?
So just because a therapist has every accreditation and qualification and probably is the most qualified therapist that exists on this earth, doesn't mean you necessarily are going to get along with them, and they're the person for you. No,
and I'll say briefly that speaking to somebody the other day, and they were trying to get hold of me for 2-3 weeks, that's an old number of mine, and they said they reached out to somebody else, and they said during the assessment it was very, and this person had lots of qualifications. Oh, okay, yeah, so when do you want to start? When are you available? They didn't get to know the person. And he said, yeah, I just didn't feel the warmth. I didn't feel like they cared. And speaking to one of my supervisees recently, he said the difference he tries to make with his clients is that I actually love what I do. And I love my clients, my patients, and that's what I bring into the room. Whereas naturally you do need a heart for counselling, for therapy, for psychology. But I do believe that we could be so formal and rigid that the person there who's sitting there with their trauma doesn't feel it. It's like, yes, you've got all the qualifications, but I'm not feeling it from you. And guess what? They don't turn up the next week.
And Edith, same question to you. Where do you start and what do you look for?
Yes, I really appreciate what Gary's saying. And I want to tell you something. I've been a clinical psychologist for 30 years almost here in the United States. And what seems very common sense for me, and I'm like, of course, just go to therapy, just to, I've realized more and more and more that it's such a hard journey for a person from the moment they decide that they want therapy or that they need therapy to the moment where they feel in that place, what Gary was describing, safe and connected and understood. And that's why I love talking about this. I'm very excited that actually mental health and going to therapy is destigmatized more and more, thanks to COVID, thanks to people Gen Z, and thanks to social. Like, I love it that we are talking about this, that everybody's interested. I don't know how it is in London, Gary, but definitely here in the United States, we're all full, overwhelmed. I have like months of waiting list, and everybody wants to be in therapy. So I'm all for that. I'm very happy for that. But I want to even start by something very specific and very basic, which is the difference between a psychiatrist and a psychologist. Let's begin with that, and let me know if in other parts of the world it makes sense. A psychiatrist is a person that has studied medicine, is trained to give medication. Most psychiatrists that have an MD after their name. So that's why when you're going through the list, and Holly, I hope that was helpful for you too. Like, you go through the list and you see MD after the names, that's great and wonderful. They're medical doctors. That doesn't necessarily mean that they know how to do therapy. They know how to prescribe, how to give medication, maybe for anxiety, for depression, for OCD, for ADHD, for psychosis, for bipolar, all of that. But that doesn't necessarily mean that they're going to sit with you for an hour and do this proper therapy. So that's psychiatry. As psychologists, then we have a whole range, and then it can be a counselor, it can be a psychotherapist, it can be a coach. Sometimes in the United States, in order to be called a psychologist, you have to have a PhD or you have to have a PsyD, meaning a doctor in psychology, a doctor in philosophy. So you have to be a doctor. That means that you have to have a doctorate. In my experience, it's important that people do have some length of training and expertise in order to do therapy, also depending on the topic and depending what you do. But I recommend people first and foremost to look for those letters of PhD or PsyD, PSYD, because that guarantees that at least a person had many years. I mean, I studied for 15 years to be a psychologist in this country, but that doesn't guarantee that you're going to have a good therapist or you're going to have a good connection. But I'm saying, like, that's a good way to start. A coach that has no letters after their name can also be good, or a social worker can also have that. So that's not requirement. I'm just saying these are possibilities. So a psychologist, a social worker, a counselor, a psychotherapist, a coach, these are all varieties of things. And then another thing to look for, and then and then we can move forward, is what is it that you're looking for specifically? Because are you looking for help because of your ADHD, because you need help with how to concentrate more, because you're hyperactive and you don't know where to go? Are you looking for help because you are getting divorced, or you're not having a relationship with your spouse or with your partner or with your lover? Are you looking for help because your parenting skills are, you think you're doing good, but you're all over the place, or you don't know how to handle your kids, or because you have problems in school? Are you looking for help because you have an addiction, because you have addictive behavior with alcohol, with drugs, with shopping, with sex, with porn, with whatever, all of these things are specific. So let's say if you're going to the doctor because you have a heart problem, you don't go to a gastroenterologist, you don't go to an eye doctor, you go to the cardiologist, right? Like, it's very specific. In the same way, in the field of psychology, we have specific qualifications and specific trainings. If you're going for sex therapy, you're not going to go to a child or a school psychologist. You're going to somebody that knows about couples, that has experience in sexuality. So I encourage people always to be very specific about what they're looking for the issues that they're looking for. And then I can continue. And then, what else do you look for? You look for the cultural, similarity. You also look for something in person. I usually encourage people to try to be in therapy in person. That really makes a big difference. It's okay also to do it on Zoom or online, but you can have both.
And how do you find out that their specialty? I assume it's just read their bios. I mean, most therapists that I've seen come with a bio and they'll explain the areas that they specialize in. Would that be correct?
Yeah, I mean, a lot of the times it's in their bios, but a lot of the times is really picking up the phone. I tell people this is like going shopping. You go shopping for the person that is going to fit you. It's not the first, when you go shopping, you just don't grab the first dress or the first pair of pants, you just wear it and go with it. You go look for it, you try it out, you ask the questions, you see how. So go call the person and say, what's your specialty? Hello, I want therapy. What do you specialize in? In children, in adults, in marriage, in addictions, in behaviors, in traumas, depending on what it is, there's certain kinds of therapies that are specific to that. For example, I work with trauma. Trauma is one of my specialties. EMDR, somatic therapy. There's all kinds of specific things related to trauma specifically. So these are all questions that you will need to be asking.
And we have a question on screen. I'll come to Gary for this one first. From the Clever Traveler, what questions should I ask a therapist to see if a therapist is a good fit for me before committing?
Okay. Well, tagging off with what Edith was just sharing, are they specialised in what I need help with? So if I'm suffering with alcohol addiction, is this therapist specialised in working with alcohol addiction? And when people ask me questions, the most potent ones are the question where they say, what made you go into therapy? What's your why? Because then you're finding out what's the reason why this person is doing this work, and can I relate to that? Also, another important question to ask when you're looking for a therapist is how do you work? What's your style of therapy? So some people might be very short-term solution. Other people might say, I go down and identify the root or the root causes. This would be long, but what's your style of therapy? Because that helps me understand, okay, what the treatment's like to be, manage expectations. Would I be comfortable with this? Clients often come and say, especially in the UK, I'm not sure about the US, Edith, whereby it's CBT. And really what they're asking for is just give me the tools to move on. They forget about the cognitive side, just give me the tools and I'm okay. And so I have to manage their expectations and see whether, it does fit for them. But I'd say that those are the important questions that as somebody seeking therapy should be asking.
And same question to you, Edith. What are the questions that you should be asking, or me as a person who is seeking therapy should ask to their potential future therapist?
Yeah, so I would ask, I agree with Gary. These are very important questions. I would ask some of the practical questions and then some of the style questions. So practical questions. How long is the session? Is it half an hour, 45 minutes, 1 hour? How much do you charge? If you're not going through insurance, how much do you charge to make sure? Is it in person or is it virtual or is it both? Is it telemedicine? Another question to ask, what's your specialty? What's your background? Are you more of a cognitive behavioral? It's not that's not too many options. It's either cognitive behavioral, psychodynamic, more human relationship and human. No, Gary, what else? Like 2 or 3 different options.
Yeah.
And that's it. So that gives you an idea of people are going to go more into like very practical ways of doing, or they're going to go back into looking at your childhood and your whole history. What's your culture? Also, I think the cultural piece is important. It's important to talk about it. Are you comfortable with somebody that has an accent, with somebody that is a different culture from you, with a different religious belief? Some people even have a problem with political issues. I mean, here in the United States, for example, there was a time in which, Democrats and Republicans could not sit together. I don't even know if it's still like that. But these are all these things that are important to ask. You don't have to know the whole story, but to really know, is this a safe space for me to be dealing with my issues? And going from the very practical, then to the very like nuanced one. And sometimes for the nuanced questions, it's more like experiencing one session. I would encourage people usually to say, just have one session with that person to see if it clicks, to see if you're comfortable. And then you can have, one session with 2 or 3 other people and then compare. Are you okay with this? Are you okay with that one? What resonated with you more?
I remember, sorry, carry on.
No, absolutely, all yours.
No, so I do remember one client in particular asking me, can you help me? It was very direct, and they're asking they were very vulnerable. And I had to really pause and consider that question. It sounds very obvious, but I had to be true. Like, can I help this person with regards to the struggle they were presenting to me? I did say yes, but I thought it was such an important question and brave for them to ask that. Can you help me?
I love that. I've had that question asked also. And sometimes, we really have to be very honest how to answer that question. I really appreciate that. So yes, I also pause and say, I can help you. I cannot guarantee anything, but I can help you. Or sometimes I'll say, I can be here with you. And you also need a psychiatrist, that this, that, the other, and maybe there's a group of professionals that need to be involved. So it's a great question.
Is it
Edith, can I
important?
ask you? Sorry. Edith, can I ask you a question just based on what you said previously about sampling? You didn't use the word sample, but trying 2 or 3 therapists. Is there, I don't know if the culture's different in the US compared to UK, is there, whilst people should have the freedom of choice, is there a danger where it's a taste and see, where you then end up, sometimes the client themselves don't actually commit to a therapist because you may hear people say, I've had 3 or 4 different therapists and they didn't help me. I'm now trying to use the 5th person. For me, that raises alarm bells because I think, okay, if you had 4 therapists, there's something wrong with your selection process. What's going on here?
For example, no, that's a great question. And whenever I'm seeing somebody for the first time, I ask them, have you seen anybody else? Are you already in therapy? I don't think it's very healthy to have many therapists at the same time. I don't recommend it at all, actually. I don't think it's a great idea. What I suggest sometimes at least in the US, we give a consultation session. Sometimes we don't even charge because there's a question here in the US, especially, how do I minimize the money spent on the shopping around face? Honestly, I've given consultation sessions for 15 minutes for no charge. And I think a lot of therapists do that. So you get a feel. I also need, me as a psychologist, I also need to know if the patient that is coming to see me is a good fit. It's not just the patient that is deciding that. I'm also deciding. So we need those 15 minutes at least, or some moment. I do it usually over the phone. Sometimes I invite the person in and I say, have this with me. And that's it. I'm not going to continue a therapy, more sessions until you've decided the one person that you're going to see. So that is something to check and to make sure it doesn't happen, and say, I understand you're shopping around. You could do one session here, one session there, but you have to make a decision. And then you make the decision with the one person that you stick with. And then you have to have that commitment to do the work. If it doesn't work at the end or later, okay, you can change, but definitely the commitment to one person.
I know that you described it as it's like shopping. I don't know if you're familiar with the singer Meghan Trainor,
Yes.
who wrote all about that bass. The other day, she was on a podcast and she said that sort of picking a therapist is like dating. You go on the first date, see if it's a match. Oh, well, maybe we'll do a second date and see if we progress, from there. And then by the 3rd date, you probably know if it's a yes or a no, and if you're going to continue or go with someone else. Now, that made me smile. I thought that was a funny way of looking at it.
That's a great way, as long as you're not dating many people at the same time.
Also not unhealthy, but it's an unhealthy practice. So, and in terms of when you're looking for a therapist, is it important that they have experience specifically with yacht crew?
I mean, I can, for my answer is, I rather, if I'm a crew member and I have issues, let's say with alcohol or dealing with somebody on the board or having some sexual harassment, I'd rather go to somebody that has some idea of what the crew life is about, or that can really has some information about what's going on, than with somebody that is clueless about it. Now, it doesn't mean, from, because then people ask me, oh, you mean you have to be sexually abused, divorced, discriminated against, being an immigrant, in order to help people that are sexually abused, immigrants? No, no. I don't have to live every single thing that my patients have lived in order to help them, but definitely have an informed understanding of the culture where they come from. For example, like, I work with people that are very religious. I'm not religious at all, but if I don't understand the religion that they come from, it's very hard for me to be in that place and to hold them, what is culturally acceptable, not acceptable. If I don't know anything about the yachting culture and somebody's telling me, oh, I drink every day, I might say, you are off the charts. But in the yachting culture, that's a norm. That's more of the norm. That's more of the average.
And Gary, what's your take on that? Is it important for someone, to have worked with crew in the past, or it's just, working with people in high pressure environments?
They're in agreement with Edith. There does need to be an identification, especially within the yachting industry, because it is so unique, which we cannot be overemphasized. So I would think it would be very difficult, say for myself, who hasn't worked specifically on the yachting industry, if I didn't have an idea of the culture and what goes on, the working practices through the people that I socialize with and work with on a professional basis, it would feel very foreign for me, and therefore I may not give the right treatment to somebody who's worked in the industry because I don't really fully understand it, and that therefore wouldn't be right for the client, and also doesn't make them feel safe because you're working with somebody who doesn't, in layman's terms, doesn't fully get it.
And no, that's a good point. And I guess one of the biggest difficulties with yacht crew seeking therapy is that the time that they have isn't really their own, and trying to slot it into their schedule that's quite erratic. And I know that a lot of people do therapy 4:00 on a Tuesday. Do therapists have the flexibility to be able to offer kind of ad hoc sessions, or be able to squeeze it in around the crew's schedule?
That's a great question, Holly. Actually, I mean, I've worked with crew. I love them. I mean, these are people that I absolutely love, and they were in Australia and New Zealand, and I'm here in Miami. And we went through hoops just to schedule a session, but obviously it required from me. I always was laughing with my colleagues about, like, oh, I have a patient that is on the other side of the world. It took us like 15 minutes just to find the time to schedule a session, and obviously it was on Zoom most of the time, unless they were here on the port of Miami. But I had to put from my as a psychologist, the intention and the willingness and the openness to be flexible. Yes, maybe with my other patients, of course, I have the same Tuesdays at 4 every week, fine. But if I'm working with a crew, if I'm working with people on boat, I definitely have to have the flexibility. Otherwise, it's not going to work. Because, as you very well said, that's not something that happens every week at the same time in the same place. So sometimes, it was 10 at night, sometimes it was 7 in the morning, sometimes it was on a weekend. And yes, I cannot have, I was perfectly fine with that. I cannot tell you, like, I could have 10 patients like that, because that would be all over the but having one or two, it's okay. I think it's important, and that's a great thing to know. If you're looking for a therapist, make sure that the therapist is flexible, that the therapist is willing to go with you with your schedule, that the therapist is open for changes and not keep like charging you every time you change something. So it requires somebody that understands that, and somebody that is willing to be open and informed about the uniqueness of working with the club, the seafarers and the yachting community.
And Gary, do you have anything you'd like to add?
No, Edith hinted at it. It's being flexible also that there may be last minute cancellations. And it's accepting that because it goes with the industry. If the captain says you need to be required on the boat tomorrow without prior knowledge, you've got to roll with it rather than saying, okay, sorry, that's a late cancellation, I'm charging you.
And there's a question on screen from Tammy. Thank you for your question. How can I be sure which type of therapy is best for me? We touched on a couple of these earlier: cognitive behavioral therapy, psychodynamic, and humanistic. I haven't heard of that third one actually, but I'm not the pro. So when you see these on screen, what do they mean, and what are the terms of kind of each one of these three that have been listed? Gary, do you want to go first?
Sure, I'll start with the humanistics. That was really promoted by a gentleman called Carl Rogers, and he changed the style of therapy whereby less of the therapist being an expert, it was more on an equal footing. And it was really, its three conditional factors were congruence, unconditional positive regard, and empathy. So unconditional positive regard is that you offer the maximum respect to the client. Congruence means that you as the therapist is completely showing up as your true self. And empathy, we know, that means that you'll be able to feel what the other person's going through. So it's very much whereby it's on an equal basis. So you'll work with the client in terms of drawing the information, the answers from the client themselves. So you're not there ready to say, right, you've got that question, I've got the answer. Like, no, I'm going to help you tease it out. I'm going to help you to come to realize, increase awareness regards to the problem you have and how best to work through it. So it's more of a collaboration between the therapist and the client, and it's very popular. With CBT, as I mentioned earlier, it's more about what thought are influencing your behavior, and it's then changing the thought to make a positive behavior. Many clients, as I said earlier, that they don't really want to spend too much time on the thought process. They just want to change the behavior. And I say, well, we can't change the behavior unless you change your thinking. So sometimes it could be a struggle. It's making the client aware why there's a process, why it's called cognitive behavioral therapy, not just behavioral therapy. And psychodynamic is where you go deep. You're going back to, I'm sure you diffuse that with trauma-based clients. So that's when you're not just looking at the here and now going forward. It's going back as to what happened in the past that's currently affecting now or causing what's going on in your life now. I personally, carry on. No, carry on.
Okay, I was saying, I guess it's also not about me choosing, well, I want CBT or I want this kind of therapy. It can also be up to the therapist to say, actually, I think this style and this approach might be better for you in your specific situation.
Yes, I mean, I think as professionals, we have a responsibility to guide our clients and to make the recommendation. I feel for you and what you're going through, what you're looking to achieve, this is the best course of action for you. It'd be like us going to a doctor and us telling the doctor, no, you need to prescribe me this. You wouldn't do that. So whilst there's input from the client, you wouldn't want to work with the client without their agreement. Once again, we do have a responsibility to say, I believe this is the best modality for you. And if they disagree, say, for example, they strongly want CBT and I think they need to go down the psychodynamic route, then I'm perhaps not the best person to work with because I'll be doing myself an injustice by just go down a route. I don't know if it's best for the client. So I would then say, perhaps maybe you should work with somebody else.
And Edith, do you have a take on this?
Yeah, I'm impressed with Gary describing the modalities. Very good, Gary. It's funny because sometimes, patients come and say, how they are advertising for medications and patients go to the doctor say, I think you should give me this, that, and the other medication. And I'm like, where are you coming that from? No, go to the psychologist or go to the therapist and say, this is my problem, this is the situation, this is what I want to, and then hopefully the responsible therapist and the good one, like Gary's saying, is going to say, maybe the best course of action for you is something that is more cognitive behavioral, or maybe the best course of action for you is more somatic therapy or more eye movement desensitization, or you have to do a combination of medication and psychodynamic. It depends. And not every therapist has all the specialties, and not every therapist can do both CBT and DBD and DBT, and some of us have one more than the other. It's very important that the therapist themselves is responsible in saying that, and saying, if you're looking for something specific, like for example DBT, which is dialectic behavioral therapy, I'm going to refer you to somebody else because that's not something I do. Or if you're looking specifically to work on your ADHD, okay, then I'm going to refer you to a therapist that works specifically with that, because I would do more psychodynamic or more humanistic, or so that you would be better off with somebody that focuses on that. So that's why the question about how do you work and what's your line of working or what's your specialty when you're looking for a therapist is so important. Even if you don't know exactly what's good for you, it's important to have the conversation and to keep looking. Ultimately, though, I think at the end of all of this, the human being behind all those letters and all those specialties is what counts the most.
Yeah.
If you're connecting with another human being that is there for you, that is making you feel safe, that is listening to you properly, that is not doing inappropriate things, hopefully, and that you feel like you're advancing and you're discovering new things about yourself, and that you're feeling like you're being helped, that really makes all the difference in the world.
Absolutely. And there's another question on screen. If I can't find a therapist with a flexible schedule, what can I do? Should I go to an online portal? I guess it's talking about online resources that might be a helpful alternative. Do you have any recommendations?
So, Edith, what do you want me?
Yeah, go ahead. I mean, I think what we already said, like, it really, you have to ask for the schedule, and maybe most of the time with a flexible schedule, you might not be able to see the therapist in person. So it has to be a therapist that you can see online and that is willing to keep changing the schedule in order to fit it to what's going on in your life.
I think also, I know it's difficult to fit in the schedules when your yacht crew can be, then there's not a clear routine. But also, if you ask your captain, sometimes you might not want to disclose you're in therapy, but if I was in a leadership position, in fact, in work, the only time that I could make with my therapist was during working hours and a lunch break. And I spoke to my boss and I said, listen, I really want to start therapy. I think it would help me in my personal life, also in my work life. This is the time we've agreed, would that work? And she said, absolutely. She said, absolutely, we should be accommodating for this. So perhaps if you spoke to your captain or your chief stew or manager, they might be able to carve out the time for you to be able to do therapy. So it's looking at your schedule, looking at the therapist's schedule, and also making sure that there's provision on board for you to be able to take the time you need for your own mental health.
That's wonderful, Holly, that you did that. And that's an amazing recommendation to say there's nothing wrong with being in therapy. It actually might improve my performance. Can we carve out some time that is respected for me to have this session once a week? That's wonderful. I think that's a great solution.
And if they say absolutely not, then there are alternatives, but also I think that's not a particularly good show of leadership.
Yeah.
Maybe you can change it at that point.
I know we're going to be wrapping up this session soon. This is actually what I wanted to talk about, cost and insurance and how that all works. Scott Kidd has said, are there better options for insurance coverage where some of these sessions are covered? I'm not actually sure how insurance for yacht crew works. That's something that I should really look into. Do all therapists take all insurances? I guess not. Can you guys speak to that?
I can only speak very briefly into it. Something that PA Rachel's looking into, because we've had people require, like, do we cover insurance or take insurance for mental health therapy? And we don't at the moment. So it's something we're looking into, but I can't, so I'm not qualified to answer this question right now.
Yeah, and also in the UK, therapy is, health insurance is a much bigger topic in the US than it is in the UK, because in the UK we have the NHS, or we have sort of private healthcare. Edith, do you have any views on that?
Yeah, so there are a few alternatives. Some therapists don't work with insurance at all. Like me, I don't work with insurance, but I work with a sliding scale, meaning like some depending on what goes on and what situation I negotiate with the patient and say, okay, what can I have this sliding scale, we can fit you in it. But if if you have insurance, most people don't know that insurance covers therapy. So that's one piece of information that is important to say. Insurance most insurance do cover therapy. That's part of the medical and health field, and it's okay to ask. The second thing is that insurances might not cover all the cost of the whole session, but might cover some percentage, which is very helpful. And the third thing is that sometimes the therapist might not be in the network of the insurance, but insurances accept out of network therapy, meaning that if you show that you've paid for your therapy sessions and you send that to your insurance, they reimburse you. So that's another option. So there are and there are many other options. A few other options as well. So keep looking for that. I encourage people always to say, okay, let me pick up the phone and talk to the insurance and see what are my alternatives. Inform yourself. Don't let that be the reason why you're not in therapy. There's always a way around it. I work with some networks of therapists that really charge very low money because it's a whole network. I actually train the therapists in those networks, and for $50 they can get some great sessions. And there's other options as well. I think here in the United States, you can always go to the American Psychological Association and get some more information of therapies that are available. There are pro bono organizations that provide therapy. So that should not be an excuse.
There's always an option.
There's always an option.
Wonderful. We've come to the end of our session. Again, like the last one, I could have continued to speak to you both about this for another half an hour, I'm sure. But if anyone's watching and is interested and wants to reach out to Gary or Dr. Edith, their email inboxes, I'm sure, are open. But thank you so much. And I'm sure we've got Andrea appearing on the screen any second now.